Welcome to this edition of the eClinicalWorks podcast. I'm Adam Salati, and we're here at Madera Community Hospital in Madera, California, speaking with them about what's made them so successful in their technology implementations. And with me today is Karen Paolinelli, Chief Operating Officer, and Nikki Resendez, who is the certified trainer and clinical technician. Is that what?
EMR
support specialist. We actually saw you not too long ago at our national conference in Nashville, Tennessee this year. So what's new since then?
Well, we had a wonderful time at the conference. We were very happy and lucky that we were able to go. And we learned a lot of different things, and the list is pretty long of all the new things and the new technology that we learned while we were there. But some of the things that we are working on is we haven't really worked with eClinicalSense much, and we've been actually trying to implement that into our practice and get our doctors to use that. That's one thing that stands out as a provider to me. That's been very handy. And then, of course, working more on the patient portal and more with some of our back office staff. I'll let Nikki talk about some of that.
Yeah, so, just getting the back office to use it more like the defaults and things like that. We have it built in for our providers, but not so much for our back office. So getting them to use more order sets. We've been building more templates, hiring more providers. So getting everybody on the same pages.
And we're here in your training center, so I've heard that that's getting a lot of use lately.
Yes, it has. I believe every week I've been training different providers, and we have different things going on. So we haven't really implemented anything new, like as for the features that we've been seeing that we want.
Well, it's only been 2 months, right?
Yeah, but we're definitely eager to start with some of the new things.
And I bet you're really glad you have that certified trainer certification in a situation like this with so many new providers coming on. Now, you mentioned eClinicalSense, and why is that so important to you? What about that stands out?
It was always there, and I never used it until I went to the conference, and I realized that maybe it wasn't turned on or working right, maybe, and that's why I didn't know how valuable it could be. But once I saw it at the conference demonstrated to me, I was like, oh, wow, because you didn't mention this, but I am also a provider. I'm a nurse practitioner. And when I can go in there and hit eClinicalSense, I can, change the drop downs to all providers. And I can look at, like if I'm treating a patient with hypertension, I can look at the past treatments for that patient or for any patient with a diagnosis of hypertension. And it will give me an idea of what patients are being treated for in our practice for hypertension. And it gives you any labs that might need to be ordered for a patient with hypertension, any medications that might need to be ordered. If there's an x-ray that may, be associated with that type of a diagnosis, then you can order that. And what makes it really nice is because it's just all there. You don't have to, search for the medicine and things like that. And usually when I do pick those and I use eClinicalSense, it's always the drugs that I use. So it just makes it very easy to click, click, click and order all that stuff. It comes right over into your EMR, and it's very, very neat. Very neat feature.
More efficient than searching for each
efficient,
individual medicine,
yes.
like you said. And then you have to pick the dosages and things like that. So eClinicalSense has done that for you.
And it brings everything over right into your progress note. And so it's great. And then you just send it on to the pharmacy or activate the order, and it goes over, and they order the x-ray and the labs, and it's all, one smooth click.
Now, for those people who might be watching who haven't seen our podcast from the national conference, tell us a little bit about your organization and your patient population.
Our clinics where we use eClinicalWorks are rural health clinics. They're nationally certified rural health clinics. And we are owned by Madera Community Hospital. And we service all patient types and all different insurances and all different ages.
Medicare patients, private payers?
All of them. All payers. We take Medi-Cal, Medicare, insurance, self-pay, whatever the patients.
Whoever walks through the door, I guess. Whoever needs treatment.
We truly are really a safety net for our community. We see pretty much everybody.
It sounds like it's good to have somebody like you in the neighborhood. So with that population, wide-ranging population, lots of different demographics and different types of people walking through the door, what types of population health measures are you focusing on at the moment?
Well, we are looking at the HEDIS measures. That's what we have been focusing on in our clinic, and we've been working with eClinical on making sure that we can break that down by our different clinics. I didn't mention that we do have 3 clinics. We have one here on campus. We have 2 here on campus. One is a family practice clinic, and the other one is a specialty clinic. And then we have one in Chowchilla, and it's a family practice clinic. And we do have some specialists that rotate up there. So what's really unique about our place is that if patients come and they get seen by the primary care providers, our specialists are right here on campus also, and we can easily make a referral to that specialist. And so what we do is contract with a lot of specialists. They come here, they see patients, and our patients just come on over to our specialty clinic and they see the doctor on the day that they're scheduled. What's nice about that is that they're in our EMR, they're using eClinicalWorks also. And so all the, the information about the patient is right there and available to that specialist.
So having all those different specialties under one EMR in one database, making a big difference for you.
Yes.
Now, for the HEDIS measures, you are using the eClinicalWorks HEDIS dashboards. Is that correct?
Yes.
And which measures in the HEDIS dashboards are you particularly focusing on?
We're looking at hypertension, so controlling patients' blood pressures in our facilities. We're looking at smoking status and treatment for that smoking addiction. We're looking at BMI. We're looking at medication reconciliation, and we're looking at making sure our patients that have diabetes is under control. And what's really nice about the HEDIS measures is that it looks at all your patient population, and at a glance, you can monthly look at where you're at with your measures. I'm able to click on and see if there's a benchmark. I can look at the benchmark and see if we're meeting the benchmark. And if we're not meeting the benchmark, I can very easily drill down to what patient it is I'm not meeting the benchmark on. So you click on the patient, it brings it up. I can say, okay, this is a patient. Next time he comes in, we need to, be after him on making sure that his diabetes is under control, or maybe adding another medication because his hypertension's out of control. So it's really, really helpful.
And planning to use the closed loop alerts with that as well to get that back into the EM?
We do use alerts. We've always used alerts, and it really, it's helpful. One of the things that I've found on the provider side is that although the front office and the back office do really good with alerts, the practitioners don't do as well with them. And, when a doctor goes in to see a patient, they don't pay attention to all the excess stuff. They go right to their progress note. They look at that. And so what we do if it's something that the doctors need to do, we go to their appointment that's scheduled and we make sure that it's in their chief complaint. What are they here for? Hypertension's out of control. Or we'll put in there, see the alert. Or, we make it very clear so it's on their progress note so that they know that this needs to be addressed and they need to go to that. So otherwise, they don't tend to look at the alerts, unfortunately. But our staff does, and it works really well for the front office staff and the back office staff.
I guess sometimes you need to tweak the way you're doing something or the way something's designed to make sure that the intended audience is doing what they need to do to get the most out of it. And it sounds like you're doing that.
Yes, we are. And the doctors like that, and it reminds them, and they don't have to look in a lot of different places to get the information, and they are busy. And, of course, they have a lot of patients to see, so we try to make it as easy as possible.
It's moments like this that make me go another year. 4,500 attendees, 49 states, 5 countries for the first time. 450 eClinicalWorks engineers, support staff, trainers, product specialists. Mingle with them, ask them questions. 50 exhibitors, hands-on training. It's just full. The most exciting product showcase, 16 plus demonstrations for you. We will blow you away.
Don't miss this extraordinary 3-day event, which we'll cap off with an amazing night of dancing, music, entertainment, networking, and much more. Come join us for our 2016 National Conference in sunny Florida at the Orlando World Center Marriott from October 21st through the 24th. For more information and to register today, visit us at specialevents.eClinicalWorks.com.
I heard that you recently got some tools to help you with electronic prescribing of controlled substances. Is that correct?
Correct.
Yes. So Nikki and I had a conference call with eClinicalWorks, and I guess that's a new service that eClinical now has. And so you can now prescribe narcotics via eClinicalWorks, where in the past we could prescribe all the medicines, but if it was a controlled substance, we had to write a prescription. So you had to pay for controlled prescription pads. So we just ordered our little token, I think is what it's called. And
So we're waiting for those to come in.
from what I understand, and I haven't used it yet, is that once I receive my token, I can, put it on my badge and keep it with me. And when I get ready to order a controlled substance, then it gives me this verification code on my badge. And then my logging in is a verification that it is me, and I'm able to send electronically that prescription over to the pharmacy, which is really wonderful because there is a lot of abuse with narcotic medications. You're always worried about your prescription pad and that getting stolen from you, or people taking your information off your prescription pad, your DEA number, your license number, and somehow recreating a prescription pad with your information and using that to phone in medications or write prescriptions.
So all sorts of metrics and things going back and forth. Are you also measuring any kind of provider productivity?
So we do monitor the providers. I monitor their meaningful use monthly, so I have spreadsheets and kind of snapshots of how they're doing. And I know Peter Garcia, our clinic manager, and Karen, they do the performance improvement, so the PI monthly to see, who the star providers are, see how many patients they're seeing an hour, things like that, that you've been doing for some time now.
Now, do you feel like being a certified trainer gave you an edge when it came to making all of those different specialties work in
most
one
definitely.
EMR?
Most definitely, because every provider is different. They're going to say, okay, I always chart this HPI, I don't do this, I do this. So, day one, training with me, they learn the EMR, but also once I go through my kind of itinerary, I tell them, okay, now I want you to show me. So that's kind of like an eye-opener for them, like, oh man, I really have to use this thing, So once they start using it, I'm like, you're not going to use it with all of these things. We're going to cut all this out. Okay, I'm going to build a category that says, nephrology. So we're only going to have your categories in here. We're going to build your defaults from your normals to your abnormals. So it makes them feel more at ease knowing that I'm building it for them. It makes them feel special. It makes them feel more confident, like, okay, I can go in here and I can chart on things that I would normally do. They don't see everything else that eClinicalWorks has to offer.
It's very focused.
Very focused on their specialty.
And their order sets, you build those for the doctors.
Their order sets.
So, if you're a nephrologist, you're really focused on the kidney. And so you're going to order labs and x-rays that are pertaining to the kidney. And that's all your order set needs to be. You don't need to see all the thousands of other labs and x-rays that could possibly be ordered because you're never going to probably order those. But if you do, you have the availability of picking them up. But, on the most part, you're just going to pick up that order set. Ding, 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 ding. I'm going to order these things and you're done.
Yeah.
And that's what it's hopefully made for, to make your workflow fast and easy and customized to you. So what are some of the other projects that have been possible because you have a certified trainer on staff?
Well, the possibilities are endless, really. Nikki's great. She's wonderful. She knows the EMR better than anybody. And I can't say enough great things about having a certified trainer. I think every facility should have one, or every office. She stays on top of all the EMR issues and problems. She's a tech support. Our IT department hardly ever has to come out into our clinics. Nikki handles everything. So not only does she understand the EMR really well, but she understands the technical side of it really well also. And that's self-trained, and she's done a great job with it.
I imagine it also came in handy when, like you said early on, you had those templates that you found didn't work. You must have had to change those, and then you probably had to let people know about all those changes and get people on the same page. I'm assuming that came in handy at that point as well.
Well, and we're a really good team, Nikki and I think, because I'm a provider. I don't always have time to really research all these things. Although if I see something that I don't like, the first thing I do is either take a picture of it or do a snippy of it, and I send it to Nikki, and I said, Nikki, find out about this. I'm not liking the way this is looking, or why can't it do this for me? And so she researches it with eClinical and comes back with answers, and then we say, okay, this is great. Let's train all our providers. And so every time we find new things, we kind of work together, and if I didn't have somebody to hand things off to like that, it would probably never get done, because as a provider, you just don't have time to do those things.
Sounds like technological therapy almost.
It's just little things. It's little things that people want differently, and it's so customizable, and they don't realize it, unless they have somebody that can show them how to do that. So,
and then, you must have things that make your job easier when you go to show all these people, like, look, yes, I've heard you. These are the changes that we've made. What have you done, or what do you do when that happens?
So, like, for me, anytime a provider comes to me, hey, Nikki, this isn't working, or I'm finding I'm doing this a lot, or, if I don't know the answer first off, then I'm like, okay, let me get back to you. Let me get with eClinicalWorks, see what I can find. So eClinicalWorks has made it very, very easy with their customer portal. So they have tons of, what are the webinars, they have documentation. So I'm constantly going on there watching videos, because everything changes just like our workflows. eClinicalWorks is constantly evolving as well. So I want to stay up on my skills. So I'm constantly, reading or watching those so that I can learn and, find out how to help our practice evolve and, be a better trainer. Whenever I can't find what I need, my Sam and our office manager, they're really great at reaching back to me. If I have a question, they're quick to respond. So I'm really thankful for that I have the resources that I need to get back to our practice.
If you had to look back and choose one workflow that has made a big difference towards your success, what would you say that was?
Well, there's many things that have been, very successful in using eClinical and workflows. But one of the things that stand out to me on a provider side is the jelly beans. The jelly beans were a little overwhelming for a lot of providers in the beginning, because if you can imagine, you were on paper, and we used to just have stacks of charts and papers and labs and x-ray reports that we had to go through, and prescription refills, and we used to do that all on paper. But now you get an EMR, and you have these jelly beans, and these are little things that look like jelly beans that tell you how many labs you have in there to review, how many x-rays you have in there to review, how many prescription refills. And so that number starts getting pretty large very quickly when you're seeing a lot of patients. And I think when you're new on an electronic record, it can be a little bit overwhelming, because you're so focused on seeing your patients and trying to learn the electronic record, and you're not realizing that, okay, I have to look at these labs and x-rays that come back. And I have to say that we've been very successful in keeping those numbers down and working on some workflows on how to handle and manage those.
Yeah, effective jelly bean management seems to be one of those early hurdles for new practices, and sometimes that can linger, for a long time after your implementation while you're trying to deal with those other things. So, it is good to know an effective way to deal with that. Now, what happens when providers are out of the office or on vacation, or like you said, you have these per diem providers that are coming in, maybe once a week, or I don't know, maybe even less frequently than that? How do you manage their jelly beans?
So for them, we did create a jelly bean buddy list. So all of our full-time providers, they are assigned, a couple specialists, a couple of our per diems. So that way, we know that these labs or these results are constantly being worked on. So, a specialist that comes maybe once a month or once a week, they'll have a buddy, and so it'll be one of our full-time providers who will review those results for the patient.
And you have a list of these buddies?
Yes, so we have a list of these buddies.
We've got one right here, actually.
Yeah, we have one right here. And we have them posted in all of our workstations. So, whoever is working on the labs, or if they get something from the inbox or a call, telephone encounter, they know, okay, if I have something for this specialist, I know I'm going to send it to their buddy. And they have these reference guides wherever they may need them.
Good to always have that information handy. Thank you again for your time and your insights. It's always a pleasure to speak with you. Hopefully we'll have the chance to see you again, maybe at next year's national conference.
Yes, we're hoping so. We really hope so.
If you'd like to see more of our podcasts, you can check them out on my.eclinicalworks.com. They're also available on YouTube and for download on iTunes. For the eClinicalWorks podcast, I'm Adam Salati. Thanks for watching.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.